In our Investigator Spotlight series, you will hear about investigator projects, how HEAR experts contributed to the project's success, and how their project contributes to HEAR's goal of expanding our understanding of environmental exposures and human health. Today, Dr. Chandy John, active clinician specializing in pediatric infectious diseases and tropical medicine, and a professor of pediatrics and director of the Ryan White Center for Pediatric Infectious Disease and Global Health at Indiana University School of Medicine, discusses his project, Micronutrient Deficiencies, Environmental Exposures, and Severe Malaria, Risk Factors for Adverse Neurodevelopmental Outcomes in Ugandan Children.
So the project within which the HEAR project was subsumed or included was a project looking at neurodevelopmental outcomes in children with severe malaria. So our group had described that children with severe malarial anemia and cerebral malaria, which are two forms of severe malaria, have worse neurodevelopmental outcomes. So worse thinking processes, worse behavioral outcomes, worse mental health outcomes. And these are long-term outcomes, 1 to 2 years after disease, and probably even longer than that. And so where the HEAR project came in was to see, besides severe malaria or in synergy with severe malaria, did other factors, environmental factors, and what they did to the host response to malaria, would any of those things alone or together have an effect on children's cognitive outcomes and on mortality in severe malaria? In the new study, we were looking not just at cerebral malaria and severe malarial anemia, but at 3 other forms of severe malaria. So the questions that we came up with were whether or not some of the worse outcomes we saw, both in terms of mortality and in terms of worse neurodevelopmental outcomes among survivors, were contributed to or made worse by specific environmental factors or by the host response to those factors.
How did consultations with HEAR experts contribute to your project?
I think it was a good chance for me and our whole research group to reflect on how other factors might interact with or add to the effects of severe malaria to lead to death or lead to worse neurodevelopmental outcomes. So it was an opportunity to say what else is going on that might be making things worse. And that's important in terms of our overall goals, because our primary goal is to prevent deaths from severe malaria and to prevent brain injury and worse neurodevelopmental outcomes from severe malaria. And it was a collaborative work to come up with what would be the best idea for this project, because we don't know the environmental side of things, and the HEAR group is not as familiar with the severe malaria side of things. And so we had to work together. And so I know that we had probably a couple iterations of what made sense to look at in this population, with feedback from them and then feedback from our group and back and forth. I can't remember the specifics of how we changed things, but it definitely was an interactive, iterative process that I think came up with the best way to look at the question and the best use of the resources that HEAR has to offer for this particular study.
How will your HEAR project advance our understanding of the influence of the environment on human health over a lifetime?
Our goal is, these kids are coming in with severe malaria. How do we prevent them from dying? And if we do prevent them from dying, then how do we prevent them from having these pretty severe neurodevelopmental consequences of severe malaria? And so we're already treating them for the severe malaria, and yet some of them die, and some of them that survive get these neurodevelopmental problems. And so the question is, what else can we do in addition to treatments for severe malaria that would decrease their risk of death and decrease their risk of cognitive impairment? And so if we do find that particular environmental factors or particular host responses are contributing to either one of these, then we could think about therapies or supplements or other things that might lead to better outcomes for kids than just malaria treatment alone.
Would you recommend HEAR to other investigators?
I would recommend HEAR to others, and it's the reason I would recommend it is that I think that it gives an opportunity to look at things that, if one isn't in the area of environmental health, may be quite important in a study that didn't focus on environmental health. So I think anybody who does this kind of work and looks at outcomes like cognition in particular knows that there are maybe a number of things that are important that we're not measuring and that relate to the environment. And so I think the expertise of the groups in HEAR is extraordinary. And there's a real chance for kind of amplifying the breadth of the work that's done in a project like this, as well as the potential impact and future work, because if we find things that are related, that's an area for future study. And ideally, if the correlation's strong, possibly future interventions that might make things better for the children who are affected by severe malaria. So I think it's really an extraordinary opportunity to work with experts in the field of environmental health, even if one is not in that area oneself, if you understand what might be gained by doing that. For the micronutrient analysis, the HEAR group did a very extensive and quite complex analysis of how micronutrients together and singly differed in children with severe malaria as opposed to children who were in the community, but otherwise well. The 90% of what we needed for the analysis was done by the HEAR statistics group, and they did an amazing job.
To hear more about the other investigators, check out our interviews with individual investigators in this Spotlight series. Thank you for watching.